This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Eris, a senior attending in neurosurgery.
And I'm Dr. Lara, a neurosurgery research fellow. Today we're looking at a fascinating new study from the Journal of Medical Internet Research, 2026. It's titled The Real-Time Support Role of Augmented Reality Technology in Shared Decision-Making in Neurosurgery under the SEGUE framework, a randomized controlled trial.
This is a timely paper, Lara. As we know, preoperative risk communication is the cornerstone of what we do in the clinic before we ever step into the OR. But it is notoriously difficult. We are often trying to explain high-stakes procedures involving incredibly complex neuroanatomy to patients who are understandably stressed.
Exactly. The paper highlights that traditional verbal explanations, even when supplemented by 2D imaging, can severely limit a patient's understanding. This gap in communication doesn't just affect the patient's peace of mind, it directly contributes to patient dissatisfaction and, unfortunately, can lead to medico-legal disputes.
That's the why behind the study. The authors set out to see if augmented reality, or AR, can provide a more effective platform for shared decision-making, or SDM. Instead of just talking through a case, they used patient-specific interactive 3D visualization.
And what's particularly interesting for our residents and colleagues listening is that they didn't just show some cool 3D models and call it a day. They structured the entire interaction under the SEGUE framework. For those who need a refresher, SEGUE is a research-validated communication framework. Set the stage, elicit information, give information, understand the patient's perspective, and end the encounter.
It's a rigorous way to look at a conversation. Let's dive into how the AR technology actually functioned as real-time support during these SDM encounters. Ilara, how did the patient-specific aspect change the dynamic compared to our traditional methods?
In this RCT, the AR wasn't just a generic brain model, it was the patient's own anatomy. By using interactive 3D visualization, the surgeon could virtually show the pathology in relation to the patient's own vascular or eloquent structures. The paper suggests this provides a level of clarity that verbal descriptions simply cannot match. It bridges the spatial reasoning gap that many patients and even some medical students struggle with when looking at 2D slices.
Right. If I'm explaining a vestibular schwannoma or a complex aneurysm, I can describe the risks all day. But when the patient sees the 3D relationship between the cranial nerves and the tumor in their own head, the shared part of shared decision-making becomes much more literal. They aren't just taking my word for it. They are seeing the surgical corridor.
And that's where the real-time support element comes in. The study emphasizes that this isn't a pre-recorded video. It's an interactive tool used during the SEGUE-guided conversation. Under the give information and understand the patient's perspective phases of SEGUE, the AR allows for a back-and-forth dialogue. The patient can ask, "What happens if you go this way?" And the surgeon can rotate the model in real time to explain the risk.
This seems like a direct response to the problem of medical-legal disputes mentioned in the abstract. If a patient truly understands the neuroanatomy and the specific surgical risks because they've interacted with a 3D representation of their own brain, the informed part of informed consent is significantly bolstered.
Precisely. The study suggests that this interactive visualization helps align the surgeon's technical goals with the patient's expectations. By improving the understand the patient's perspective portion of the SEGUE framework, we can identify patient concerns that might not come up during a standard verbal explanation.
So, for the residents listening, this study suggests that AR isn't just a fancy toy for the OR, it is a communication tool. It's about using technology to facilitate the SEGUE framework more effectively. Ilara, what would you say is the bottom line for a practicing neurosurgeon based on this 2026 trial?
The bottom line is that AR technology provides a real-time, patient-specific support role that transforms preoperative risk communication. By moving away from purely verbal explanations and moving toward interactive 3D visualization within a structured framework like SEGUE, we can potentially improve shared decision-making and reduce the dissatisfaction that leads to legal complications.
It's a shift from telling the patient what we will do to showing them why we are making these decisions together. Fascinating work. Thank you, Dr. Ilara, for breaking this down.
My pleasure, Dr. Eris.
And thank you to our listeners. This has been the Neurosurgery Hub podcast. Stay tuned for our next episode where we continue to bridge the gap between cutting-edge research and clinical practice.